This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
Well, the month of November has brought us more than just crisp air and the promise of the impending holidays. It also brings attention to something else. It's less visible than the lights and decorations, but it's far more urgent.
Yeah, this month marks COPD Awareness Month, which means paying extra close attention to the millions of Americans living every day with this chronic illness. And it's something that the fine folks at TidalHealth Home Care also pay close attention to. And we're with Beverly White. She is the Vice President of Business Operations at TidalHealth Home Care, along with Chris McLean. He is the Clinical Manager. Welcome, both of you, to DelmarvaLife.
Thank you.
Thank you.
So let's just start off with the basics about COPD. What is it?
COPD is just a short term for a chronic obstructive pulmonary disease. It's actually a lung disease that affects more people than what people really realize. COPD is your chronic bronchitis, which is inflammation of your lungs, and emphysema, which is the deterioration of your lung sacs that help bring oxygen into your body and dispel CO2 from your body.
Okay.
So why is it so important for folks to learn about it?
It's really important. Unfortunately, COPD is a lifelong illness. Most Americans get diagnosed after the age of 40. So there is no cure. So it's really symptom management, knowing what triggers you have, and then knowing how to manage it so you can have a normal life once you are diagnosed with it.
Okay. So Beverly, tell us about the kind of programming that TidalHealth Home Health Care has for people with COPD.
Yes, so because it is such a highly prevalent disease, and it really is highly prevalent here in our Eastern Shore area, last year we developed a very specialized program. We on our team have a geriatric nurse practitioner, and we are partnered with one of our other local ventured partner companies through TidalHealth. So we have access to a respiratory therapist. What we do is, in our specialized program, we utilize our liaison at the hospital to help to triage and screen patients. So when they come to us for this specific program, we're able to do a risk assessment as soon as we open them for services in the home. We're able to send out our nurse practitioner for an in-home assessment, and then also do a respiratory therapy assessment in the home to help them with extra resources. We have a full-time medical social worker. So with this specialized program, we do very specific education. We help them learn more about their medications. We're even able to see if they're able to, because many of our patients are not able to afford some of those medications, so they are not compliant, and they are in and out of the hospital frequently because their progression of their symptoms become even worse because they're not able to afford some of the medications and inhalers that they're on. So this way, we help to reduce their risk of rehospitalization and reduce the severity of their symptoms with the specialized program that we're able to offer.
So why is it better to treat COPD at home?
Treating it at home is, for us, that's really where most people spend most of their time at. So we're able to identify things in their house that trigger an acute flare-up of their COPD. Teaching them in the home, people are more comfortable in their home. People don't like going out to, here to certain specialized programs, or they're unable to get out to the specialized programs in the community. So we're bringing all the tools for them to where they're most comfortable at.
So what's the feedback been like from people who have received the treatment?
Oh, incredible, because we also know that for many of our patients, they are at a much higher risk for infection. And this time of year, we know that flu and RSV is very predominant, and our COPD patients are at the highest risk of exposure, and even being in the hospital or being in facilities. So our feedback is phenomenal because we help reduce that risk significantly. They also welcome our staff for coming in. It feels like family, and it helps them to recover with their own family. And because we're not just there for the patient, but we educate their caregivers on how to best help them and help them feel more comfortable and safe in their own environment and make adjustments. So it's, always positive. So
That's wonderful.
We're very proud to serve the community.
That's wonderful. Beverly White and Chris
Absolutely.
McLean with TidalHealth Home Care. Thank you so much for being here
Thank
today.
you for having us.